I'm going to time it while you go through it.
Good afternoon, and thank you for joining us today. We are Alpha, Kappa, Invicta and COCO 2020, and today we want to take a closer look at the impact of COVID-19 on the healthcare industry in Virginia. These are our team members: Jasmine Demery, Bailey Rummel, Aaron Kilch, Asta Malhotra, and Annie George. We start by identifying trends amongst the employment and healthcare. The pre-COVID trend, as seen on the left, shows that prior to COVID, we were expected to experience constant growth. However, the data on the right shows that there was a significant drop in employment in April with a slow recovery following. With not as many people being employed, it begs the question, are the people of Virginia underserved when it comes to healthcare? This map shows that Virginia is in fact underserved when it comes to availability of healthcare professionals, and rural areas are most impacted by this. Is this due to a lack of licensed medical professionals available to these areas? Our data shows that despite being underserved, the amount of people receiving both nursing and medical degrees is still quite high. This chart suggests that we should have more than enough healthcare professionals to combat a shortage, which disproves our original hypothesis and suggests that the issue is not a lack of healthcare professionals, but instead is the misallocation of doctors and nurses in targeted areas. So why is there a disconnect between our theoretical capacity and the reality that a growing number of people lack access to doctors in Virginia? Our team recommends that doctors be better allocated to target areas to ensure patients get the right care at the right place, including increasing the number of house call services to increase access to care. In terms of allocating doctors and nurses to targeted areas, Virginia could implement incentive programs as well as relieve restrictions to insurance use for house call services. This would ensure the underserved areas would be properly staffed, free up space in hospitals across Virginia, and aid in the quarantining of infected individuals to reduce risk to healthcare staff and at-risk patients. The most telehealth services are restricted to individuals in rural areas. A lack of broadband access could prevent those individuals from utilizing the telehealth services. Therefore, the increase in broadband technology would decrease the amount of time healthcare professionals spend per patient. All in all, these are our conclusions. There is additional research to be conducted to prove our recommendations, which will be further conducted. Thank you. Have a great day.